Our next guests are as impressive, and certainly our interviewer, Susan Solinsky, has an extraordinary background in digital health. She's the co-founder and chief growth officer for Ellipsis Healthcare, and she's also the director of the HITLAB Women's Health Tech Initiative, and has been the leader of that on so many levels over the last few years. And we cannot thank her enough for all of that. And for those of you who don't know Ellipsis and their short history, they have been giving a voice to and a new standard in mental health care. They've harnessed the really unique power of voice as a biomarker for mental well-being. And they do that through a number of different techniques, including machine learning and AI and things like that. And Susan and the larger Ellipsis Health team have been able to establish the only clinically validated vital sign for mental health. And if that's not an enormous step forward for digital health, I don't know what is. That's really exciting. Susan, welcome to the program. Thanks for joining us today.
Oh, thank you, Stan. It is so exciting to be here. I think you know that today's symposium joins my two passions, creating a healthier future for all through women's health and mental health. Today, I am so excited to discuss with Dr. Bradley Carlin how technology can help us reimagine mental health. Dr. Karlin is a celebrated national leader in behavioral healthcare transformation and innovation. He's the Vice President and Executive Medical Director of Behavioral Health at Highmark Health, and he's also an adjunct professor at Johns Hopkins Bloomberg School of Public Health. He previously served as Vice President and Chief of Mental Health and Aging at the EDC. So Dr. Karlin, first of all, thank you for being here. To start off our interview, would you please share how you characterize the current state of mental health care?
Yes, Susan, thank you, and pleasure to be with you and everyone today. So we are at a time of unprecedented need and opportunity for mental health care. It's a double-sided coin. So in terms of need, mental health problems are at an all-time high, but there were certainly high levels of unmet need prior to the pandemic that just did not rise to the level of broad public consciousness. And so COVID-19 added fuel to an existing fire. So I think it's important to put this into context, but certainly the last 2 years have exacerbated access challenges and have presented an overwhelmed delivery system, especially for children and adolescents, I would say. We knew that there were few providers for children and adolescents more than 2 years ago, and certainly that's even more so the case now. But let me share a few statistics that are startling, kind of tell the story even more. So only 40% of those in need of care get any kind of mental health treatment. Only 15% of individuals receive what would be considered minimally acceptable treatments, according to clinical practice guidelines. And for those that do get care, there's a significant lag time to treatment of 8 to 10 years, in some studies even more, from the initial onset of symptoms to engagement in treatment. And unfortunately, therefore, the industry has been characterized and very limited by a very downstream model of behavioral health care. So there are many significant unrealized missed opportunities due to variable quality as well, and lack of engagement. And so we know that first-line treatments, grade A treatments recommended in clinical practice guidelines are not usually those delivered in the clinical front lines. We know that folks tend to present once they're really at a pretty severe level of need in most cases. Also, the field has been highly fragmented historically, not personalized. So it's been a one-size-fits-most approach. So personalization, something we talk a lot about in healthcare, it's not been realized in behavioral health. I mean, the mode treatment is you refer someone for therapy or medication, often for months or years on end. I would also note that the industry has been also very limited in contributing to some of these phenomena that I've mentioned by outdated 1970s reimbursement and financing models that really are fee-for-service based, don't emphasize or incentivize quality or upstream earlier intervention. But let me just spend a quick moment to then talk about the other side of the coin, though. The other side of the coin are certainly unprecedented opportunities. And this is largely due to something I'm passionate about, technological and clinical innovations over the last couple of years. So health economists have estimated that in the last 2 years, the field of behavioral health care has innovated the equivalent of 20 to 30 years 20 to 30 years prior to the pandemic. And this is largely the result of interest and actions by external forces, admittedly not from within the field. It's largely the venture capital and private industry that recognize considerable need and also a somewhat sleepy industry that's ripe for innovation. So we had sort of a perfect storm, fortunately and unfortunately, occur over the last couple of years that has propelled the field forward. I think there's a lot of promise to be realized. Hasn't quite been realized yet. Field is figuring itself out right now. It's a moment in time, but it's an exciting moment in time.
Thank you so much for that overview. So you started to touch on this in your answer, but I wondered if you could tell us that as you think about your work at Highmark and other organizations, how is technology actually really starting to change the field of behavioral health?
Yeah, this truly is a defining moment for the field of behavioral health care and how technology can help shape the industry. So I'll mention a couple of areas of particular opportunity and also how it is related to our work here at Highmark Health, which, for those who are not aware, is a payor and a provider system. We operate one of the nation's largest Blue Cross Blue Shield networks, but we're also a provider delivery system as well, which presents some unique opportunities. So first area that I think presents some real opportunity, and we've already been seeing this, is telebehavioral health, is a delivery of behavioral health through virtual modalities. So Highmark experienced close to a 7,000% increase in telebehavioral healthcare delivery in 2020. That sustained in 2021 when pandemic pressures eased. And I would say that's not only a function of greater physical access to care that telebehavioral healthcare provides, but it's also a function of greater, what I refer to as psychological access to care. So more positive attitudes and acceptance related to two phenomena. One is the experience of the pandemic normalized stress to some significant extent. Pandemic did not discriminate in that regard. Behavioral health issues and treatment, and receiving behavioral health care through a computer screen or a cell phone has helped to destigmatize behavioral health treatment. There's something about receiving care through that modality in the comfort of one's home, in a familiar environment, not having to go to a mental health clinic, which sits separate from maybe the physical health clinic, is a very different psychological experience. But then in addition to telebehavioral health care, digital applications, digital solutions within behavioral health present particular opportunities, namely to serve as lower intensity interventions, as we refer to it in the field, and to do so at scale. So lower intensity interventions is something that the field has been in search of for decades. And it helps free up more specialized capacity and allows for more upstream focus, as we've been talking about, and more personalized care. So you can meet folks much earlier in their clinical trajectories through the provision of a digital solution and more bite-sized interventions. So there are now upwards of about 20,000 digital mental health apps in market, fueled by the venture capital industry. And in 2021 alone, I believe it was over $5 billion that were invested into this area by the venture capital community. And I would say that the field of digital mental health is in gangly adolescence right now. Most solutions have little or no evidence, and engagement rates are typically, according to the literature, less than 5% with these solutions after a couple of weeks. However, the best solutions present great opportunities and have been shown to be quite effective, sometimes on par with clinical interventions, for therefore helping to really scale these kinds of interventions and help solve issues of access and moving more upstream. The last opportunity that I'm really excited about for the field, and I think presents a renaissance of sorts, is one that allows for moving even more upstream, and that is the field of digital phenotyping. So digital phenotyping involves using passive data acquisition through cell phones or wearable devices to detect changes in behavior. So that involves detecting certain signals like rate or rhythm of speech, a certain content of speech, changes in physical activity levels. So greater sedentary behavior would be a signal of a behavioral health problem, perhaps. Changes in social communication, changes in sleep. These are all signals that may identify or even predict a behavioral health problem before a patient or even a PCP is aware that there is a problem. And as I talk about this as not being science fiction, and you know this, Susan, from your own work, but it's an emerging reality with some data really starting to validate the use of these types of approaches. And if you think into the future, how this could really reshape the industry, and how this could help us connect with and touch individuals much earlier in their clinical trajectories and within their own lives, I think it's very exciting.
I could talk for 2 hours on that answer alone. I particularly appreciate that you brought up the stigma and misconception around mental health, because I believe we still have work to do there. We have about 5 minutes left, and this is really the meat of what I was hoping that we could hear from you on. As a thought leader, you're a fierce champion of this topic. What is your vision of the future of behavioral health care? Where are we in 5, 10, 20 years? What's going to be our future?
Yeah, and this is a moment in time that I'm very hopeful we don't look back 5 or 10 years from now and see some real missed opportunity. And I would say that we need to fundamentally transform how we provide mental health care. It's not just about solving for access. It's not just hiring more mental health providers. There are very few to hire anymore. It's really changing the paradigm, and that requires a significant partnership with technology. So let me share kind of my own vision of what the future could and should look like. So, and I've alluded to some of these themes so far. So one is being much more upstream focused and proactive, and leveraging and integrating technological innovations to early detection and treatment, moving away from the predominant downstream focus, moving from the one size fits most approach to mental health care to mental health care being much more personalized and right-sized. And certainly, again, technology plays an important part of that. Moving from what has traditionally been highly siloed and fragmented approach to mental health care being integrated into healthcare, into primary care and other healthcare settings clinically, but also integrated into one's everyday life through the use of technology, digital solutions, digital phenotyping, and so forth. And that's again important because to the extent that we can incorporate this in an integrated way into people's care experiences and into their lives, it doesn't carry that psychological stigma. It doesn't seem like the other. And it doesn't seem like it's a problem that I don't want to address because I might have self-stigma, for example. And also, by the way, I can't fit this into my life. Next, I would say is we need to truly realize the quality promise of mental health care. So not all treatments are created equal in behavioral health and mental health care. And so we need to make sure that the treatment shown in randomized control trials, those that have the greatest evidence and can be deployed through technology innovation, are those treatments and interventions that people are receiving. And then we need to really think about then how we can optimize the workforce to support a more upstream and personalized approach to behavioral health care. So that means moving from what is now a very labor-intensive and inefficient way of utilizing the workforce, where we're using licensed independent providers who go to school for sometimes decade or more to do things that they don't necessarily need to do. So behavioral health coaching is now becoming introduced as an opportunity for task shifting, for shifting some of the tasks that licensed independent providers don't need to do. And behavioral health coaches can support individuals, for example, in using digital solutions and increasing engagement and increasing outcomes. And then lastly, I would say we need to move from the traditional financing model that has characterized the field to a value-based and alternative payment model arrangement, so that we can really therefore incentivize the delivery of high-quality treatment, incentivize wellness and moving more upstream. That's going to be obviously a key ingredient to getting to where hopefully we can be. So I would just say this is a turning point for the field of behavioral health care, and we need to rise to the challenge and the opportunity.
Thank you so much, Dr. Karlin. This conversation is especially relevant now, given the state of our world. Thank you so much for your perspective, and it was an incredible honor to hear from you. Thank you, Stan, so much for this opportunity, and thank you for all you do for women's health and mental health. Really appreciate being included.
No, Susan, thank you for your leadership, and really appreciate this time. Thank you.
Great, thank you.
And just a very important conversation and revealing, again, particularly with having two guests on the program that are not only leading the healthcare ecosystem, but leading a lot of the change that's happening there. So, I think when we start looking at the ecosystem and we start looking at the leaders that are there and making the differences there, we're seeing this effort, and we're seeing these types of components in a way that we just haven't seen before. And so that is it's a tribute to what's happening from folks like Ellipsis, who are leading the way in creating these new solutions. And then obviously it takes a lot of effort and a lot of work for folks to bring that together at the Highmark state. And when you talk about a major ecosystem stakeholder like Highmark, that's not easy. One of the things we do want to talk about at HITLAB is something that's very exciting, and that's something that we do twice a year. We have call for applications for the Breakthrough Alliance, and it's called the Breakthrough Innovators Challenge. And the Spring Challenge this year is now accepting applications until the end of day, Friday, June 10th at 11:59 Eastern Time. And so we want to make sure that everyone here either applies or has some friends apply, colleagues, coworkers, et cetera, and it can take advantage of a lot of the benefits and a lot of the prizes that are not only including HITLAB services and studies, but also a lot of opportunities to present at symposia like this, at summits, and at other types of seminars that are ongoing in the HITLAB community each semester. And HITLAB takes no equity, and there's no fees for being a part of this accelerator in innovation. So looking forward to having people apply to that. And then also a part of Breakthrough Alliance is the individual membership called Breakthrough One. And this allows people to amplify their brand, accelerate their networking opportunities, get to know C-suite, V-suite, C-1 folks that are around the ecosystem, tap into the 300,000 plus HITLAB community members, and also receive all kinds of clean transcripts and slides from all of our events, get auto registrations, and be invited to cocktail hours, which we'll be doing one on Tuesday, May 31st, next week. Yeah, we'd love to have you join us there. And the Breakthrough One memberships include general, professional, executive, and global. And again, you can go to our website to see more details here, but it's exciting and it's a lot of fun, and you get to meet a lot of very cool new people. So hoping to see some of you on the Breakthrough One roster and getting involved in that.